I'm Maria Carney. I am a physician, internist, geriatrician, and palliative medicine physician. My role at Northwell Health is Chief of Geriatrics and Palliative Medicine for the system and Medical Director for Continuing Care.
Thank you, Maria. What brings you to health?
I've been invited to be part of a socially prescribed care panel discussion, and I'm here to discuss our book with Michael Dowling, the CEO of Northwell, called The Aging Revolution. Which addresses some of the topics we'll be talking in the panel.
Yeah. Well, tell me a little bit more about that issue. So focused on how to provide better access to healthcare for an aging demographic?
Yes. Yeah, exactly. Baby boomers are now turning over 65. In the next decade, there's going to be more individuals over 65 years of age than under 18 for the first time in our country's history. And our healthcare system was really made for acute illness, not for managing multiple chronic conditions. And we've made great progress to promote longevity, how to manage diseases, but we've lost sight of care, coordination of care, and the role of caregivers playing in healthcare delivery. So the book addresses this, and I think the healthcare trends really need to address this demographic, keeping things simple, understanding who's helping provide the healthcare plan, and in a really complex healthcare system.
Yes. You mentioned keeping it simple in a complex healthcare system. Often minds go towards, in this environment where we constantly need more from less, and we need to care for a growing population. Technology can be here to save the day.
Right.
But often we overcomplicate and overbake these things from a technology side and then kind of miss the mark completely.
Yes.
What advice generally would you give to, say, that the tech community, the vendor community, or those that are creating the technology to ensure they're not wasting their time with some solutions that kind of miss the mark?
Great question. Technology is only as good as who's on either side of the technology. So are you building the technology for the healthcare clinician? Are you building it for the insurance company? Are you building it for the patient? Are you building it for the patient's caregiver?
Right.
And as we get older and complex, are the electronic health systems communicating with each other? They aren't. Are the pharmacies communicating with the healthcare systems? Not always. So we have to somehow unify, communicate simpler, and build a system that is very, very user-friendly.
That'll be important. There's all different users with different requirements.
Yes.
So being able to really hone in and understand those key stakeholders you're working with is going to be pretty critical. What are some of the biggest kind of challenges? With the demographic, those that are over 65, it's going to be the biggest focus for the US. What are the biggest care needs that you're finding that this population has?
Yeah. So let me say that we are living longer and more productive and healthier than any other generation. But as we get older, we start, I'll use the word, accumulating, gathering different illnesses. So the unique part of being in an older demographic is you have multiple conditions. But we're in a healthcare system that is very disease-centric. So we know how to manage heart failure, coronary artery disease. But do we know how to manage somebody with congestive heart failure, dementia, severe inflammatory arthritis? No, we don't. We have not built a system to help coordinate the multiple chronic conditions. And when individuals start having functional needs where they need care, that gets even more complex. So when you get into that phase of aging, you have to start thinking, how are we delivering services to the home? Get medications to the home, get caregivers to the home, have medical care in the home so that it's easier on the caregivers, and individuals who can't get to doctor's offices aren't using the emergency departments as their primary care, which we're finding is often the case.
Yeah.
The highest utilizers are those with functional needs, complex care. They can't get to the doctor's offices, and our primary care is not built to care for that population.
Yeah. It's interesting that point that you raise about the complex multimorbidity nature of healthcare generally. That extends right through healthcare, right up to the front end around clinical trials. We're so good at excluding people because they don't fit a particular mold for this particular thing, but it's not actually representative of what happens in the real world. So
exactly right. That is a great example. We exclude the individuals that need to be included.
Yes, yeah, which is who's going to be receiving the most amount of care. So, and are there any particular technologies or things that excite you, or innovations that you think are perhaps fit that criteria of being simple and effective, and would be really effective for in that example of perhaps bringing more care into the home and into the hands of the patient?
I've seen some technologies that are focusing on the family caregiver, bringing them in to identify what resources are available to them. Our healthcare system, Northwell Health, is really developing caregiver centers in our hospital so that it can link individuals, and then we can look up what zip code the individual lives, the patient, and try to connect them to resources. So there are social determinants of care, and if you don't have a caregiver, you can't access healthcare, you don't have transportation, you can't get your food. So having a caregiver or not having a caregiver is a social determinant of care. And I think any technology that brings them into the healthcare system is advantageous.
Yeah, that's a good point. Hey, yeah, you've got the book here. You mentioned it earlier. What would I find in there, and why would I get it?
Yeah, thank you very much. The Aging Revolution is by Michael Dowling, CEO of Northwell, myself, and Charles Carney, and it outlines how healthcare trends have changed historically to now, and it talks about Robert Butler, the first director of the National Institutes of Aging. It talks about home care delivering care in the home by physicians, nurses. It talks about the family caregiver, age-friendly health systems that are developing and we're promoting at our health system in partnership with IHI. It talks about the industrial complex of health care, from insurance, Medicare Advantage, insurance companies that are trying to make these products, and how primary care really needs to be reorganized to help this multiple comorbidity population with services and help from social workers to help them. So it really looks at healthcare trends, which is important. There's a lot of books out there about aging and what we can do as individuals, but this is about what healthcare systems should be thinking about and doing to address a growing population's needs.